Hey, so I'm an orthopedist. In New York, and similar to Dr. Gooby, who has a fascinating video that he's put out on YouTube, I came to much the same realization, probably about the same time that he did, but took a different turn. Um, I think it's very important to scale these messages. I'm glad he chose to scale them from some mountain wilderness somewhere. I'm only in my backyard, but the message is pretty much the same. Um, when I was training in residency, I was exposed every day to all sorts of surgeries. I mean, some of them you can't do without. Car accident, you break your femur, we can fix that. Same thing for hip fractures or arthritic pain that's making it difficult to walk and everything else has failed. But many of the procedures that we do electively for atraumatic joint pain and various tendon pains, they just shouldn't be done. At least the vast majority of them shouldn't be done. Um, the body has tremendous healing potential, and the word healing in and of itself is a bit of a fallacy too, because you're assuming that these tears are the cause of your pain when in fact they're often not. Um, I remember seeing plenty of patients, runners, cyclists, weight trainers, with various tears of the labrum, rotator cuff, meniscus, ACL, etc. And just naturally assuming when I was young that these needed to be fixed surgically. I would advise them not to participate in sports until we fixed it. I would suggest not waiting too long so that we avoid joint damage, quote unquote. And then, if you pay attention to your patients, you start to realize that many, not all, but many will ignore your advice. So they'll continue running or continue weight training, walking, and so on. And when they come back, they're often feeling better. Similar to Dr. Gooby, I began to catalog and track the traits of those who were getting better. He attributes it to the diet more so than anything else. I don't think I agree with that, but I definitely traced it back to those who were active. And in general, people who are active tend to eat a better diet. Is it all vegetables and fruits and grains? No. A lot of them will eat meat too. Am I purely a vegetarian? No. But do I try to have that occupy the majority of my plate? No doubt. Am I afraid of carbs? Absolutely not. As long as you control your overall calories, right? So a lot of the people who got better were of a more healthy BMI. Your BMI does matter. Your weight matters, I guess, especially if it's in the belly. These people were more active. They walked their dogs, they walked outside, perhaps they ran, rode their bike, rode their Peloton, swam, played pickleball, tennis, basketball. It just didn't matter. The human body truly is the only machine that breaks by being still. the other side of the equation in the office was always the patients who were afraid of activity. Um, whether they were afraid because they had an issue that arose on an MRI, or they felt pain, they were afraid of making it worse. But more so, these were middle-aged folks who were just afraid to move. They were afraid that they were going to hurt something. I went to a comedy show the other night, and the comic, I'm sure you'll hear this routine at some point, was talking about how he's 45 and he wakes up with all these injuries spontaneously. Well, they're not injuries. It's just our parts telling us that they're there. An injury takes force, takes load, takes effort, takes too much activity. Hit by a bus, hit by a car, fall from a bike, twist and fall, whatever. Those are injuries. And no, you don't sleep wrong. Your body's not going to let you, quote unquote, sleep wrong. It will hurt, it will bother them, and you'll turn, you'll move. So these spontaneous aches that arise are very often not caused actually by the joint in question. Meaning that you run to an orthopedist's office or your primary care's office, you demand an MRI, it's going to show something. There isn't a 40 or 50 something and beyond that has a quote unquote normal MRI. We have these natural age appropriate processes that appear on our head that we don't call into question, right? That hair is thinning, it's gray, we have those wrinkles around our eyes. Luckily we have to wear these little bastards. You shouldn't assume that your joints and internal tissues aren't revealing age-appropriate processes too. One day in time, our radiology colleagues will not call these things tears. They'll call them, age-appropriate changes, or hopefully we'll come up with a better word. I hate the word degeneration, but we are truly the only machine that breaks by remaining still. And think about it. From an evolutionary perspective, we weren't designed, engineered, and manufactured during times of caloric excess, or times when calories were available at all times every day, around the clock. So there were times of feast and there were many times of famine. That's why we became so good at building fat stores and storing energy. But it also meant that our body was going to try very hard not to maintain and build tissues or nourish tissues that weren't being used. So in modern times where we don't have the absence of food, at least the majority of us don't, our body has not caught up to that. So if you don't use your muscles, tendons, cartilage, it's going to degrade. It's going to become thinner. It's going to become weaker. Its ability to withstand load is going to diminish. Its capacity to withstand impact is going to diminish. Your bone density is going to diminish, right? Your body is not going to expend energy to keep your bones thick and strong if you're not putting enough force on them to demand it. So building resilience and capacity and the ability to handle that load occurs through exposing your body to those loads repetitiously in a wise manner over time. So your body can build this capacity to endure this if the load is applied slowly. That's why people who wake up one day and decide they want to run, who start at 4 miles, are going to soon find that stress fracture that's going to put them on the couch for a few months, and they're never going to run again. But yet, there are many runners running 50, 60, 70 miles a week. They don't have any issues with that. Why? Because they've built up this resilience in their tissues and bone structures. So the machine can be enhanced in terms of performance and resilience by use. And that load doesn't only stimulate tissues that respond to mechanical stress, but it has an effect on every single tissue in our body. It may not be a direct response, but our muscles release a lot of compounds, myokines, etc. And they have dissonant effects on every tissue in our body. That's why the risk of dementia, heart disease, blood pressure, fatty liver, and all sorts of other things are diminished in people who exercise a lot, or at least who move a lot. It's going to have an effect on your cardiovascular system. It's going to diminish your risk of heart failure, atherosclerosis, which will also decrease your risk for dementia, insulin resistance, type 2 diabetes, and all the downstream consequences associated with those diseases. And once those diseases are present, because of the concurrent inflammatory mediators and such that accompany them, they will degrade other tissues far from the organ that's causing them. So, for example, fatty liver results from various metabolic disturbances, creates a lot of systemic inflammation. It's often associated with insulin resistance and other issues, which compounds that. Well, that's going to get into your joint fluid and affect your cartilage. That's going to affect the pain that you have because of arthritis. It's going to affect the progression of the arthritis. It's going to affect your mitochondrial health, which is going to affect your aerobic capacity, the number of mitochondria you have, the function of that mitochondria. When the function of mitochondria go down, you don't manage glucose well, the insulin resistance worsens. It's a really vicious circle. But I think I digress. So Dr. Gooby became very despondent and depressed. I've seen this in a few colleagues, perhaps not for that reason, but so I give him a lot of credit for seeing the changes that are present in medicine, or the environment that is present in medicine that fosters things pretty much staying the same. And it really is a horrible situation. But even though I came to the same understanding, I chose to fight it from within. I didn't have the same issue with regards to depression, weight gain, etc. I think my exercise took care of that, but I definitely realized that being the busiest surgeon in the hospital wasn't helping my patients. It's just that healthcare is a business. Hospitals make money if they do something to you. If they draw your blood, if they image you, if you end up on an operating room table or in the emergency room. They don't get paid if you see one of their physicians, change your lifestyle, and never come back again. And it's that simple. Um, Employed physicians are paid by work RVU model. So an RVU is a relative value unit. Everything that we do to you is assigned a point value. And those are really stupid too. You know, your internist can spend an hour with you and they get something like 2 or 3. Yet an orthopedist pulls out a piece of meniscus in a 2-minute operation and they'll get 15. I mean, come on. But when your salary is tied to your RVUs, it's all too alluring for many physicians to go after those RVUs. So if you're in the office of an orthopedist, you know, if they give you an injection, that's an extra RVU on top of the one they got for the office visit. So it's 100% increase for that office visit. You don't need the injection the vast majority of the time, but you're going to get it. You might get a brace you don't need either, because that increases the revenue from the visit too. So this became really obvious, and I guess I was busy enough and there were enough people from my trauma presence that they needed surgery to sustain my income and everything else, while my private practice, you know, the rate of surgical indications gradually and ultimately diminished dramatically. I mean, I could walk into an operating room with a busy orthopedist and probably find them doing more meniscus removal in one day than I'll do in 6 months. Why? Am I ignoring people with knee pain who have meniscus there? No. I just know they're going to get better without me. And, you know, when we became a hospital employee, I think my RVU targets were pretty low, but that also meant a lower salary. I do a lot of things on the outside, and that really didn't matter to me. I guess that made the transition easier too. But I mean, these are people we're dealing with, right? I can't imagine choosing an operation that's not necessary because you have a country club payment due this week. It's not much different than the reason why your appliance guy, you know, breaks 6 things in your freezer to change them before he leaves your house. But the ramifications of that are far worse than just, you know, ripping someone off for a few dollars. So yeah, there really wasn't a period where I was depressed. There was certainly a period where I was confused when I just started to come to this realization. But in the end, I knew I was doing the right thing, and I haven't looked back. And it's here, I guess, where our paths had diverged. And perhaps, I think, after listening to his video, it seemed like he had to get out of medicine, at least for a little while, for his own personal health. But I chose a different path. I just was going to take the time that I had in the office to teach people, to empower you, to let you know that, yeah, you know, this thing that's going to show up on your images, it's not what's bothering you. And it's the systemic effects of everything else that you happen to be suffering from that's having the most dramatic impact on your joints and tendons. And a lot of them bought into this. Many didn't, but a lot did. And I really love that, because there were some people that would bring family members in to subsequent visits, wife, father, mother, etc. And they often took their families along with them on their journey towards better lifestyle and better overall health. So, if you change one person's lifestyle habits, there's a good chance that you're going to change a few that you're never going to know about. And I tried to change the message in the office many times over 20 years. But it wasn't until about a year or so ago where I started to put a lot of the graphics that I have up on my Instagram account up on the wall in my office. And that was incredible. I mean, the number of people who take pictures of them and send them to people and put them up on their own Instagram or Facebook accounts. The number of people who come back for a follow-up visit and say, it was these pictures on the wall that got me moving, or got me eating better, or got me drinking less, whatever it is. And that's just been fantastic. We're not going to, I love all these screams on Twitter and elsewhere, we have to change healthcare. Yeah, that's not going to happen. It's just not. I mean, this is the way that people are paid. This is the way the hospitals are paid, and all these companies, United Healthcare, oh my God, right? The way that we're going to change it is by doctors and healthcare workers in general talking about the importance of these lifestyle changes and the traits that we see in people who tend to get better. Because the people that do not adopt any changes to their lifestyle, they're not going to get better. So let's say we take, an overweight, all belly weight, 50-something, high blood pressure, pre-diabetic, they have meniscus tear, they go to therapy, it doesn't work, they don't really participate in the therapy with all they have. They've tried turmeric, anti-inflammatories, none of that works. And they have the surgery. Are they going to feel better? Maybe. For about 6 months. Maybe a year. And then the pain's going to come back. But guess what? That surgery caused arthritis. Yes, you'll develop more arthritis if you have meniscus surgery than if you didn't, period. So now what are you going to do? Now you have an overweight, 50-something, didn't change anything, and now they have knee pain due to some arthritis. Not enough that needs a knee replacement, but it's not going to respond to an arthroscopy. That won't stop some doctors from scoping that knee either. But anyway, that's another point. But what are you going to do to this 50-something? They're sort of stuck. So it's really, really important to understand that you hold the key to your ability to age successfully and to become a resilient human. And take care of your machine so that it doesn't break. Or if it does break, that it's going to heal itself. Or at least feel better. And as I said, a lot of things don't actually heal. That meniscus tear isn't going to heal, but it's not going to hurt. Same with that small rotator cuff tear. So I'm not going to comment again, what Dr. Gooby did. I think it's great. He really seems happy and content. He's taking his dog all over the wilderness, and they're shooting videos. It's making him happy. He's in a better place. He's lost weight. His mind is cleared. I think that's awesome. I think for those of us who recognize how important it is to empower people, educate people, and engage them to know what we know, I think that's really, really important. You don't need more surgeons to operate on you out there. You need more surgeons to tell you that you don't need an operation out there. That's really what it boils down to. And there are enough of us who are in financial place, etc., where we still enjoy what we do, haven't burnt out. I mean, I really get a kick out of talking to people in the office. Can't tell you how much. And if more of us stick around a little longer, and if hospitals choose to employ us, that's a whole nother issue, because if we're not bringing in those RVUs, a lot of hospitals just don't want us there. But if the hospitals are willing to employ us, to get us on their panel, to get us in front of patients, and if we can figure out a way to engage you and inform you and educate you, this world is going to be a far better place. And you're not going to need to go to the doctors as often. You're not going to need as many of those medications. You're going to avoid a lot of operations and a lot of potential harm. And that's really the way. Right?